Erectile dysfunction can be answered a lot of different ways, but essentially the simple answer is it's the inability to get an adequate erection. Now, some of you have problems obtaining an erection. Some of you can get an erection, but you tend to have a problem maintaining it. And a lot of you, maybe the vast majority, have a problem with both. How does an erection occur is sometimes asked by patients, not by most, but let me explain it to you really quick. It's kind of this neurologic, hormonal, intertwined process whereby the blood flow to the penis increases, and that makes sense. But the nerves have to release a chemical to induce the blood vessels to the penis to actually dilate, to enlarge, to allow the blood in to cause the engorgement with all that spongy tissue in the penis. That's what causes the girth and the elongation of the penis and essentially gives you the erection. The way it maintains it, though, is that the venous sinuses, which are typically on the periphery, on the outside of the penis, tend to collapse down as the interior of the penis is filling up with all this oxygenated blood. So as long as there's a brisk and robust blood flow going into the penis, that blood will compress and squeeze the veins, which are trying to drain the blood out. So that's why sometimes you may get an erection, but you may lose it because the blood flow is coming in, but not as robust as it should be, and you start leaking blood out. And that's called veno-occlusive disease. Well, erectile dysfunction is pretty common, and I think it's becoming more and more common, either because of environmental issues, medications, stress, whatnot, and or maybe because men are just more apt to be honest and talk about this with their significant other and with their primary physician, and of course with board-certified urologists. But it's about 40-45% of men as they reach the age of 40 or 45. The causes of erectile dysfunction. Now that's kind of complicated, and when you see a board-certified urologist, we look at your medical records and we start looking at, your age. That's a factor. Smoking history. Maybe we try to find something about alcohol, but we look at your medications too, and your medical problems. So high blood pressure, common cause, a true elevated cholesterol, neuropathy, diabetes, which affects the nerves, and then unfortunately, some of the medications that your physician has you on can also contribute, like your statins, like atorvastatin, simvastatin. A lot of your blood pressure medications can contribute, especially the ones that end with OL, like atenolol, metoprolol, the beta blockers. And then some of the medications you take for your neuropathy, they can contribute. So as urologists, we would never try to stop one of these medications that you're on, but we will look at that. And then sometimes it's something you really can't help, such as surgery. You've had prostate cancer and you've had radiation or a radical prostatectomy to move the prostate, or if you had radiation and surgery. These can influence and damage the nerves, the blood vessels as well. So there's a lot of causes, and when you see a urologist, we go over that with you and try to help you through the process and let you understand why you're suffering with the problem. Erectile dysfunction is usually diagnosed just with a Q&A session with your urologist, a question and answer. We go through the medications, your past medical history, what disease process you had, what surgery you had, smoking, alcohol, and we go through that with you. And that's essentially how we diagnose it. It's pretty quick, but then we want to get along quickly to what are the treatment options. I'm frequently asked by patients whether or not erectile dysfunction can be prevented. Hey doc, I've been suffering this for 5 to 6 years, or the ED started about a year ago. It's kind of progressing. Is there something I can do for it? Is there something I did? Well, obviously, if you're smoking or a large amount of alcohol, taking, illicit drugs, those of course can cause erectile dysfunction. It may not be the cause, but they definitely, contribute. if you're overweight, you have type 2 diabetes, I'm sorry, but type 2 diabetes in most Americans, that's a disease that is not genetic. It's something that's that it's dietary that you've let happen. And so weight loss helps. Controlling your hemoglobin A1C, get your glucose down, exercise, get your cholesterol down, eat properly. So all these things do really benefit. I can't promise it will, resolve your erectile dysfunction, but all these things that you do on a daily basis, you can choose to eat properly. You can choose fitness and workout. You can choose to stop smoking, to lose weight, to help, get your weight down. That also helps your blood pressure. So there are things you can do, and your board certified urologist should remind you these things and help you along with these lifestyle issues. Most of you guys are talking about erectile dysfunction with your primary care provider. And you maybe tried on a medication first, and that's what you should do. And then if it fails, then you get referred to hopefully a board certified urologist. The benefits of seeing a specialist like a board certified urologist who happens to have a niche in men's health and sexual medicine is because, first of all, it's dear to our heart. If we're spending the time to make that part of our urology practice, it's probably at least 50% of what I do, specializing in men's health, then it's something we're heartfelt. We're going to be more engaging. We're going to spend more time with you. We're not going to put you on Viagra, Cialis, or injection therapy or whatnot and say, hey, return to clinic in 6 months. That's not what you want. If you're coming for erectile dysfunction, it's a problem for you. It's a problem with your significant other. You've had enough of it. You're looking for help. And so when I see people with this problem, or you see a board certified urologist with especially in men's health, you do that because you want them to be concerned and have a strong interest in your problem. So you're not just kind of brush underneath the carpet because their next patient they see is completely a different urology issue. So I encourage you to see a specialist like a urologist who has a keen interest in men's sexual dysfunction for those reasons, so that we can spend more time with you and really, really do our best to resolve this issue, or at least improve your lifestyle as fast as we can. Interestingly enough, there are a lot of psychological effects of erectile dysfunction. In fact, many, many years ago at a meeting that I attended, and this was 15, 20 years ago maybe, there was a paper that was put out and it was discussed on a podium. And I don't remember the finer details, but there was a question whether or not medications like Viagra, Cialis, Levitra, even penile prosthetic implants would be continued to be covered by insurance and medical plans, including Medicare. And at the podium presentation, there was a study that was shown that the psychological effects of erectile dysfunction were amazingly bad. And they did this not just from a urologist standpoint, but they used forms and questionnaires that psychologists and psychiatrists would use, so that it was a legitimate study from a psychological issue. And what they found was the anxiety and the depression scores were through the roof. And when these guys got help, those issues were markedly improved. And surprisingly, when a guy has erectile dysfunction, you can imagine the amount of depression and anxiety you have about it already. And then when it comes time for sexual interplay, now you're worried that you won't be able to perform. Now you're more anxious. Now you have more erectile dysfunction. And it's this constant rat race. And at some point, you've got to put a spoke in that wagon wheel and stop it. And so thankfully, penile implants are covered by the vast majority of insurance plans. Medications are covered better. And so when you see a board certified urologist who specializes in men's sexual health, getting to the bottom of this and getting you treatment and moving you along quickly is going to help lessen the anxiety and depression, which is going to make you feel better. But because those contribute to more erectile dysfunction, you can try to put an end to this rat race. So I encourage you to see a board-certified urologist who specializes in men's health to resolve the anxiety and depression and let you know you're not alone. And there's a lot of different options out there.